Hello.
So our first presentation, our first speaker is Nicol. You probably know her already. She's everywhere. And we are very grateful that she accepted to be a medical advisor to FSHD Europe, and she created the FSHD European Trial Network. And she's very efficient, and also she's very nice. And I considered moving to the Netherlands for her to be my doctor. She will present, together with Raj, an updated international standard of care for FSHD.
And you know what? Before you start, hello. Before you start, I learned something about you yesterday. I'm very sorry that Royal Dutch Airlines KLM lost an in-flight attendant person. I'm sure you would have done this as good as you are doing your job, but I'm very happy that you decided to follow the medical career rather than a waitress.
Yes, for a long time, my big dream was to become a stewardess.
Then here, together with Nicol, we have Raj Badiani. She founded FSHD UK 4 years ago. She has been very, very active since then. I assume that even before, but I don't know. And she's a member of different international organizations and doing a lot of work for the FSHD community. Sometimes I wonder, same thing as Nicol, how does she manage her time to be so active, together having a personal life, traveling the world, learning languages, and doing all what you all do. Thank you.
Thank you for the introduction.
Thank you very much. Hello, everyone. I think we've had the introductions. Today, we want to tell you about the international standards of care for FSHD. They've been revised. So these are the ISOC 2025, as we call them. Can I just hear a hurrah or a badge wave or something like that if you know about these standards of care or that they even existed? 3, 2, 1. Okay, that's brilliant. So we have a job for you later on. So let me just start with, you know about us, and this is what we're going to tell you today. A little bit of introduction, a bit of background. Nicol will pick up for methods, topics, the headlines, and then the rolling out piece is where we all come in, along with the clinicians and researchers, etc. And in particular, we look forward to what role you play in this, because I think every one of us has a stake in this. And I would hope that we adopt these and use them as we go through them. So really look forward to your feedback a bit later on after the session. And we'll take off. Does that work? So let's see if I can make this work. So these standards of care actually involved patients from the start. Some of you will have met Mitsuru, my partner in crime on this. He's at the back there. He's absolutely amazing. He's also a research scientist. Together, we were invited to be on this, along with Ronnie and Sarah, again, renowned research scientists, and helped by, as you can see there, a huge named, well-known doctors with Dr. Evangelistica, Dr. Statland, and our lovely Nicol, and really, you know, worldwide subject matter experts in some of these areas. So we can't thank them enough for their time. But the person who led us along this journey was none other than June Kinoshita. Is June here? Yep, she's the one who did this, made us all toe the line, deliver on time, and is still writing these up, as I'll tell you in a minute, as we look towards the rollout of these. So I think we owe a debt to June for some of the work she's done for the FSHD community, and in particular these standards of care, which I think are going to be very important to us over the coming months. So I'll let you just have a second to read about these and just absorb what it means to have a standard of care. I'll give you a second or two. The importance about this is that together, us with the clinicians can really make a difference about our own care as patients, but also drive the clinicians who perhaps are not that well versed with FSHD to adopt these and use them. And the power is in our hands, right? So when you have these, and some of you know about them, take them with you, take them to your meetings, take them, show them, use them. And we need these because we have had patchy, sometimes short in supply, care for our condition. It's not been well known, it's hard to diagnose, and so these form a very, very useful background and a baseline for us to start to work from. I'm doing something wrong. There we go. So there have been care guidelines, there's no doubt about that. Dr. Towell had the vision to do this in 2015. It's been 10 years. In 2019, the Dutch patient group demanded these to be refined. They were translated into English by the FSHD Society and FSHD Europe. And also the French team have launched a new set in 2024. The thing is, the world is changing. For those of you who'll hear about the therapies coming along, the fact that what we knew about FSHD 10 years ago or even a few years ago has changed dramatically even in the last couple of years. And then looking forward to us having to contribute to new topics. It's quite important that we add, as patients, what's important to us. And so adopting those has what's taken us to the current newly revised international standards of care. I'll hand over to Nicol, who'll tell you about the actual care standards themselves.
How we approach this, with the support of June, indeed, and the people, Sarah and Ronne, who are also on that slide. And Sarah and Ronne were also involved in the development of the guidelines in the Netherlands on topics which were addressed by patients, such as pain, communication, and organization of care. We worked on this between 2021 and 2025. We're in the middle of 25 and really hope to have this finished by the end of this year. June and the group of clinicians which were shown on the previous slides have been submitting to a medical journal, but their standards have also changed over the time. So we had first 3 papers, then it had to be 2, and now 1 with links to all panels. There's a lot of work for June, but we think we're nearly there. The FSHD Society took the lead in this and worked together with EuroNMD, the European Organization for Rare Diseases. And this is the specific organization for neuromuscular disorders. So NMD stands for neuromuscular disorders. Teresina Evangelista, the neurologist for France, who was involved, is the leader of this network. There was an FSHD care considerations group developed consisting of the leaders of different topics. And in total, there were more than 50 multidisciplinary clinicians and healthcare providers involved. What we did is look at the literature, so the medical literature, what is in there, and defined these teams with each 3 to 5 members. There were in total 13 topics. This literature search was done for each topic, and then there were specific questions defined before which were used to search this literature and then apply a methodology to develop guidelines, which is called GRADE. The topics were defined here. The ones in light blue are the ones which are new, so which were not included in the previous guideline of 2015. And most of them were based on consensus, where clinicians had to agree on certain statements for care, and some were based on evidence. So on these topics, there was sufficient evidence in the medical literature based on previous studies. This GRADE methodology stands for grading of recommendations, assessment, development, and evaluation of guidelines, of the literature to develop guidelines. And it's a systematic approach to assess the certainty of evidence and strength of recommendations in healthcare guidelines. So you start looking in the medical literature, what clinical studies have been performed on this topic. For example, what has been published on physical therapy in FSHD. And that can be a trial in which half of the people have been provided with that kind of therapy and the other half has not been. Or there are just observational studies where clinicians have written, we have provided this treatment to a group of 20 people with FSHD, and that different studies have different levels of evidence. Then you discuss that in a group, which I just mentioned, and then you can adjust this level of evidence. In addition to that, we use the AGREE approach, which stands for Appraisal of Guidelines for Research and Evaluation. And that is a systematic approach to assess if a guideline is well developed, based on good evidence, and maybe most importantly, clear enough to use in real life care. And I'm just showing you this to make clear that it's a long process and it's not something just look what has been done before, but it's a really systematic approach due to which these guidelines also become important, have an important value. And we would like to highlight some of the topics which I made yellow in this slide. So we will discuss them shortly in the upcoming slides. The first is on clinical diagnosis. And it highlights the aspects of the history, the story of patients, and of the physical examination a doctor performs to point out when a clinician should think about FSHD. And you could think, well, that is very straightforward, but it is to people who see patients with FSHD very often, but there are also many clinicians who do not see patients with FSHD so often, so it's very helpful for them to have a document where they can find when they should think of FSHD. And another reason why this is important, that nowadays, if a clinician thinks about a neuromuscular condition or a myopathy or muscle condition, he or she can request a genetic test which covers hundreds or 150 different muscle diseases. We call that whole exome sequencing, and the next step is whole genome sequencing. But this test does not include diseases which are caused by a repeat contraction, such as FSHD. So for FSHD, you need to perform a specific genetic test. So you need to think ahead about it and then request this specific test to diagnose it. For this genetic diagnosis, a group of geneticists worldwide wrote an article last year about how to test properly. So what is required for the genetic diagnosis of FSHD? And it's about this repeat length, which Alexandra explained about yesterday, and also about an additional test for methylation. This is included in the guidelines, and it refers to the paper which was published last year. And this paper also includes a form which the clinician can use to send in together with the genetic test form. And it also includes a referral to a list of centers worldwide where genetic testing can be performed. One of the topics was functional impairments, and one of the items in this functional impairments topic is individual exercise tolerance. And it contains recommendations on how to improve exercise tolerance. And I think it is a nice way for physical therapists to manage their treatment of people with FSHD, and it can help physical therapists who do not see a high number of patients with FSHD. And it refers to the Be Fit training module, which is available online. There's a YouTube video explaining how it works, but it's a way for physical therapists to make the physical therapy tailored to that specific person with FSHD or another neuromuscular condition. It's freely available and very helpful. You can look at it yourself, so you can point your physical therapist to it, telling this would be a way in which you can maybe even make the physical therapy a bit better. One of the new topics was pregnancy, birth, and parenting. This was a topic which was also highlighted by patients as an important part of the guidelines. And if you think about it, this does not start when a person with FSHD starts thinking about having a family. Or actually, this thinking should start at an early age, because you need to think about, would this person want to have genetic counseling. Would this person want to make use of pre-implantation genetic testing? Is that available in the country where someone is living? So it's something where you should start talking about as a clinician when someone is in the fertile age. And we do that whenever they transition from the pediatric department to adulthood. And it's not something which has to be discussed in detail when someone is 18, but you have to say, well, this is a topic where we will talk about in the upcoming years again and again, because it's important if you would like to have a family that you think about all the implications of FSHD on the pregnancy in the next generation, but also vice versa. What does it mean to be pregnant for the course of the disease? So the guideline contains topics on muscle weakness and mobility, on cardiac and pulmonary monitoring, on the pregnancy and birth outcomes, on labor and delivery, and postpartum care. And here you see an example of one of the images made by Teresina on delivery considerations. I don't have to go into detail now, but it's just an example of what it looks like. Mental health is one of the new modules in this guideline, and we're very pleased that the FSHD Society has drawn attention on their website on the importance of optimizing mental health. Nicol Voermans, the rehabilitation specialist, who's also attending this meeting and did some of the workshops yesterday, she brought together approximately 25 clinicians and a number of patients worldwide on what can be done to improve quality of life and psychosocial support for people with FSHD in an ENMC workshop. And this was a good foundation for the section on mental health, acknowledging that FSHD symptom can limit access to mental health and what are possible interventions to improve mental health. Now I'm going to hand over to Raj again.
Thank you, Nicole. I don't know how many of you resonate with a lot of those topics. The ones that we picked, I definitely can resonate with. It took almost 4 or 5 years for me to get diagnosed, and during that time it was quite worrying as to what was really wrong. And then when you actually get the diagnostic and you're actually told you have FSHD, that's even more shocking, and you're a little bit in denial. I know I started to exercise like mad, thought I could fix this, the muscles would get better. So to see diagnostic therapy, diagnostic procedures for the clinicians, but also for us to take to them, the fact that exercise should be tailored and individualistic, it makes sense now, but your immediate reaction is you can fix this thing, right? You're not going to be able to live with it. The mental health part around acknowledging that actually, especially when I got diagnosed, that I'm never going to get better, this is it, this is my life, and as day by day or month by month you get worse, you feel internally a mental strain. You don't acknowledge it, but it's there, so it's good to get support in that. And then I'm so delighted we've got the pregnancy section. For years, I'd kind of watched my grandmother and my mother, and there was a definite impact on our pregnancy muscles. And I felt like it was just one of those things, but actually so much is explained now as you realize that this condition has impacts on areas we don't even know about. So I urge all of you to have a look at these when they come out. And here's the rollout plan. So we are going to be publishing this soon, as Nicole mentioned. It will go through to the Lancet. We're going to develop a simplified summary guide, which I think will be useful for all of us. Hopefully we can get these translated country by country, and take these with you. Take the summary paper, as I said before. Make this our mission to get the care that we deserve and need. There's training coming on board. There'll be more information on that in due course. And there's training for clinicians. So do ask your clinician, have you done this training? And if not, why not? Please do it. So.
It reminds me that I would like to add 2 small comments to it. EuroNMD, which I mentioned in the beginning, in the month of May had 4 webinars on different topics of FSHD, and one of these webinars is on the guideline, where Teresina Evangelista in 60 minutes summarizes all the different topics, and this webinar is recorded and it's freely available on the website of EuroNMD. And I think the way she presented it makes it accessible to both clinicians and patients. So it's something you can find on EuroNMD and then search for webinars. euro, NMD, you see the figure, the logo on the screen, but I can point it out to you in a minute. The other thing is that I said, hopefully we're ready in December, but I realized that this is something which is never ready, so it will be an ongoing process, and we already identified 2 new topics. The people involved with care for children with FSHD want to write an addendum or compose an addendum on specific aspects in children. And the other day, together with Emma, on the stage here, we presented on advanced care planning in FSHD, which is also not included, but we will work with ENMC to make sure that there are recommendations for these topics. And I think in 5 years' time, I hope, we'll be sitting here presenting the 2030 International Standard of Care.
I can't stress those enough, actually, both those topics. And I think the thing is, this is not a tablet in stone. I don't know if you understand that phrase, but it's not firmed up. This will continuously grow. We'll refine it. I completely agree with Nicole that this will continue to add as we find out more about our condition. And this is where we hand over to you. So please look out for the guidelines. Ensure that you circulate these within your country. Attend the courses, as Nicole mentioned. I have to say the Teresina one I've definitely read through, watched through. It's excellent. And yesterday we had the genetic update from Emiliano, and that was also brilliant. So I recommend both those. Provide feedback. You know, this is ours. The clinicians don't own it on their own. The researchers don't own it on their own. The patients don't own it on their own. So together, we need to give feedback, make this better and meaningful for us. And translation, given the way our world is going now on an international global scale, we've got countries from all over the world here, to see if we can get these translated so they can be used worldwide. With that, I'd like to say thank you very much to all of you for listening. And
thank you to everyone on the last slide.
And all the organization here. And finally, if I can make this work. Yes. This is the group that was involved, as Nicole mentioned, and many more aside as well. So thank you so much.